Hi friends, welcome to classes by Lab Doctor. In today's class, let us discuss about a blood test, procalcitonin blood test. In the previous classes, we have discussed about acute phase reactant, and this procalcitonin is also one of the acute phase reactants. Okay. So acute phase reactants are nothing but proteins. So these are the proteins which are produced whenever the body is exposed to some kind of an infection, trauma, inflammation. There will be these proteins produced in the body. They can be positive acute phase reactants or there could be negative acute phase reactants. So I've told you, whenever there is an inflammatory stimulus like a tissue injury, a infection, bacterial, viral, fungal, there is stress, there is muscle breakdown, etc. What happens? The WBCs, the monocytes, the macrophages, all of them, they get activated. Okay, because they have to fight now against this stress. So what they do, they produce or they release certain cytokines, and these cytokines stimulate the production of certain proteins. So they could be your CRP, they could be your fibrinogen, they could be ceruloplasmin, haptoglobulin, procalcitonin, or complement components, serum amyloid A. They could be all these acute phase reactants. Okay, these are the reactants which are increased. There are certain parameters like albumin, like your transferrin, they are reduced. The body tries to save these proteins. So these acute phase reactants are produced to help the body fight against this inflammatory stimulus. Meanwhile, they also produce the systemic response. So patient will be having fever, patient will be having this illness behavior, patient will be having thrombocytosis, anemia, there will be biochemical changes, there will be decrease in iron, increase in copper, there will be hematological changes like anemia, there will be metabolic changes like osteoporosis, increased muscle enzymes like CPK, and all these symptoms come whenever there is an inflammation. Rubor, Calor, Dollar, tumor, all these symptoms are because of this inflammatory mediators and also these acute phase reactants which are produced to fight against this inflammatory stimulus. So one such acute phase reactant is your procalcitonin. Procalcitonin level rises in the blood whenever there is a serious bacterial infection. Okay, so this is a very valuable marker whenever we are thinking about sepsis in a patient. Doctor usually orders this test called procalcitonin. Okay, so it is not only used in the diagnosis of bacterial infection but also to monitor how the patient is responding to your antibiotics, etc. This test is being used. So now procalcitonin, the name itself suggests that it is a precursor of calcitonin. Okay, and calcitonin, you all know that it is involved in the calcium homeostasis, and this procalcitonin forms the calcitonin. So procalcitonin is usually produced by the thyroid C cells. Okay, so it is a thyroid which produces this calcitonin. So procalcitonin is produced by the thyroid C cells under normal condition. But if there is a bacterial infection and if there is inflammation, this can be produced by various extra thyroidal tissues also. Your liver can produce, your lung can produce, your intestine can produce this procalcitonin. So this acts as a significant biomarker for bacterial infection like sepsis. So this is how it is. In normal physiological condition, your thyroid C cells which are there in your thyroid gland, they produce the procalcitonin, and this is what it is produced by the normal thyroid C cells. But in case of sepsis or in case of a bacterial infection, what happens? This procalcitonin starts getting produced by various other tissues, your pituitary, hypothalamus, intestine, neuroendocrine cells, your lungs, all these can produce your procalcitonin and its level will rise. So you can see here that in a bacterial infection, there is a bacterial infection here. This is a macrophage. There are interleukin 1, interleukin 6, tumor necrosis factor alpha. So your lungs, your liver, they start producing this procalcitonin. Okay, so same thing, this is explained here how the acute inflammatory mediators are produced. You can see there is an inflammation, there is a bacteria which is coming here, it has activated the complement, there is activation of fibrinolytic system, there is neutrophilic activation, there is release of proteases, and that is what causes the tissue damage. So this macrophages releases lactates, histamine, there is procalcitonin which is produced again by your liver, your lungs, etc. So all this will cause prolonged inflammatory response. Your liver produces your C-reactive protein to fight against this bacterial antigen. So now I have told you that procalcitonin is increased in bacterial infections, in severe bacterial infection, sepsis. Okay, so it is a marker for bacterial infection. Whenever we want to find out whether this is bacterial infection, viral infection, etc., we do these tests. Why it becomes important? Because for a bacterial infection we can give antibiotics, and antibiotics will treat the bacterial infection. Viral infection we cannot give antibiotics. Okay, so now what happens, antibiotics are so much misused. For every illness antibiotics is being put, so there is antibiotic resistance. So to make a judicial use of antibiotic also, this test is going to help us. And secondly, I've told you to identify that this is a bacterial infection, this test will help us. Okay. So procalcitonin rises during bacterial infection. Why? Because this bacterial endotoxins, the bacteria produces certain endotoxins. Okay, they will stimulate these inflammatory mediators like interleukin 1, interleukin 6, tumor necrosis factor alpha, and that will stimulate the production of this procalcitonin. Whereas in viral infection, the most commonly produced inflammatory mediator is your uh, interferons. So in viral infection, the most commonly produced inflammatory mediator is your interferons, and interferon will inhibit the procalcitonin release. Okay, so that is why this procalcitonin is a good biomarker for differentiating bacterial from viral infection. बैक्टीरियल इन्फेक्शन में ये जो बैक्टीरिया के एंडोटॉक्सिन्स रहेंगे वो इंटरल्यूकिन 1, इंटरल्यूकिन 6 ट्यूमर नेक्रोसिस फैक्टर को प्रोड्यूस करेंगे जो प्रोकैल्सिटोनिन प्रोडक्शन को स्टिमुलेट करता है. वही वायरल इन्फेक्शन में क्या हो जाता है, इंटरफेरॉन्स आते हैं, वो प्रोकैल्सिटोनिन को इनिबिट करते हैं. तो अगर हमको डिफरेंशिएट करना है कि ये बैक्टीरियल इन्फेक्शन है कि वायरल इन्फेक्शन है, प्रोकैल्सिटोनिन बैक्टीरियल इन्फेक्शन में ही राइज होता है, वायरल इन्फेक्शन में राइज नहीं होता है. Okay, so the body's immune system recognizes these bacterial triggers and leading to systemic inflammatory response where this procalcitonin is significantly elevated in the blood. And the more it is rising, it correlates with the severity of the infection. So it also helps us to choose the antibiotics, because I've told you antibiotics are misused. It helps us. It is not the only test which will guide us to select an antibiotic, but yes, procalcitonin is increased, suggests you more of a bacterial infection along with other parameters. We can try and use this antibiotics. It helps us to guide, okay, to guide to the rational use of this antibiotics. And also I've told you it is just not the treatment but also the prognosis. When we put patient on antibiotic, if the level of procalcitonin is falling down, it tells us that there is a good improvement and the diagnosis is correct and the patient is responding and there is a better survival for that patient, in especially in cases of sepsis, etc. So that is a good indicator that the patient is recovering. So the normal ranges of this procalcitonin in adults, it should be less than 0.05 nanogram per ml. It is very less. Okay, so this is the normal level which indicate that there is no infection, there is no severe infection, etc., and there is very less chance of sepsis. Suppose if the value comes from 0.05 to 0.1 nanogram per ml, yes, there is a low risk of systemic infection. But yes, there can be a localized infection that is possible because it has the value has increased from the normal level. If it is from 0.1 to 0.5, there is a moderate risk. The patient can have moderate systemic infection. And if the value comes to more than 0.5 nanogram per ml, yes, there is a high risk of systemic bacterial infection or sepsis. But remember, you have to interpret this result in clinical context. You cannot just say that the patient is having sepsis just because his procalcitonin has come more than 0.5. Okay, it has to be interpreted along the patient's clinical assessment, his clinical history, his symptoms, what are the conditions which are present at that time, whether it is a case of trauma, surgery, cardiogenic shock, etc. Because these can also elevate your procalcitonin. Serial measurement is very important. Just one measurement of procalcitonin may not be sufficient. Monitoring the procalcitonin level over a time, serial measurement is more useful than a single test for guiding a therapy. And this procalcitonin values vary significantly in newborns and in children. Okay, what I told you, the previous normal values, they were in adults. So their value is different in children and in newborn. So at birth their values are high and they decline and come back to normal level in adult level within 48 to 72 hours of life. So when you are interpreting this in a newborn, you should be very careful. Okay, so you have to take into context the clinical condition, the serial measurements, the age of the patient, the history of the patients, etc., and then make a conclusion. So, if there is low procalcitonin, a low level suggests, there is a low probability. There might be less chances that the patient is having a bacterial infection. Okay, and it might tell you that you can, probably withhold the antibiotics. Suppose if the patient is having a very high level of procalcitonin, yes, it indicates that chances of that patient having bacterial infection is high, and maybe you can take a decision to initiate the antibiotic treatment. But what is more important is the context. So this procalcitonin test, it becomes important test when it is correlated clinically along with patient's history, symptoms, clinical examination, other parameters. Okay, procalcitonin is a relatively new test. It is slightly costlier test also. It costs around 3,500 3,600 rupees, but yes, it is a test which helps you to guide you to know if the patient is maybe having sepsis, or whether you can start an antibiotic treatment. It will guide you. Okay, but important thing is that yes, no test can be interpreted just standalone based on the just a test or a report. You have to take into consideration all the parameters. You have to clinically correlate that test with the patient's symptoms and examination and other findings, and then only come to a conclusion. So that was all about procalcitonin blood test. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.